Hello, everybody, and welcome to Cooperative Health's The F.O.R.U.M. We hope everybody had a wonderful month of November, and a brief recap of some of the observances for this month are National American Indian Heritage Month, American Diabetes Month, and we celebrated World Diabetes Day on November 14th, National COPD Month, and National Lung Cancer Awareness Month. And last but certainly not least, on November 26th, Thanksgiving Day, Cooperative Health hosted its first annual Caring for the Community Thanksgiving Luncheon. And we want to extend our heartfelt gratitude to everyone who made this event a success. And here are some highlights from this day's event. Again, thank you, everybody. And just as a little tidbit of information, we packed over 800 lunch plates to feed our communities. So as we bring in the month of December, wanted to highlight a few observances that we'll be speaking about in this segment. They are National World AIDS Day, HIV/AIDS Awareness Month, Universal Human Rights Month, National Influenza Week, and National Hand Washing Awareness Week. And with us today, we have Mr. Antoine Adams, who is our social work manager for our Ryan White program. He is here to speak more about HIV/AIDS Awareness Month. Please welcome Mr. Adams.
Hello, I'm Antoine Adams, social work manager for the Cooperative Health Ryan White program. On this past Tuesday, December 1st, we celebrated World AIDS Day, and throughout the month of December, we are acknowledging HIV/AIDS Awareness Month. Both of these recognitions serve as a way to support our people living with HIV and to also raise awareness and reduce stigma regarding the virus. Here at the Cooperative Health, we have over 500 people who we support through our Ryan White program and provide services to. Our program provides comprehensive medical and supportive services to anyone living with HIV, and also we provide free, comprehensive, confidential, rapid HIV testing. Part of my role here at the Cooperative Health is to recruit new people ages 13 to 24 living with HIV and to help assist them in managing their care to ensure best possible outcomes. What drew me to the Cooperative Health Center's Ryan White program was the extensive focus on our youth and young adult population. Data is showing us that not just nationally, but here in South Carolina as well, that ages 13 to 24 account for a large percentage of new HIV infections. a patient story that really touched me. I was having a conversation with one of my clients who described to me one of the most memorable things that he remembered when he first was diagnosed, and that I shared with him throughout an activity that I like to do with my clients, with changing the acronym of HIV to He is Valuable. And that was one of the things that he said, that if he remembered nothing else, that he remembered from, that time and that when he was first newly diagnosed. And that sticks to me. I think it's important for us not only to empower and encourage our clients and the people that we support, but in also ensuring that they are aware that they're still worthy, that these 3 letters don't change anything, that they still can live, the life that they envision for themselves to have. I believe that the cooperative health has a very important role in terms of being a federally qualified healthcare center, and also in terms of what we are doing here within our Ryan White program to make sure that we are specific and intentional about responding and acting out the goals of the plan for ending the epidemic, which is diagnose, treat, prevent, and respond. And we are increasing our capacity to do all those things here with, enhancing our testing, our community outreach, and also providing a wraparound services for our clients for their best outcomes, but not only that, in supporting the overall effort to end the HIV epidemic.
Antoine, thank you very much for this information and being a part of our segment today on the forum. We appreciate all of the information shared today and all of the hard work that you and your colleagues do to help eradicate HIV in our state. Events this year have heightened the public conscience around social justice and inequality. As we close out 2020, it is fitting that this month we recognize Universal Human Rights Month. This acknowledgement honors the 1948 adoption of the Universal Declaration of Human Rights by the United Nations. The Declaration outlined the fundamental rights and freedoms to which all are entitled to as human beings. The federal government partially codified this ideal into law with the 1964 enactment of the Civil Rights Act. Title VI of the Civil Rights Act prohibits exclusion or discrimination from any program receiving federal financial assistance. The old adage that healthcare is a basic human right is essential to the formation of what would eventually become known as community health centers. Health centers were the dream child of Dr. Jack Geiger, a young physician who witnessed the effectiveness of a community-based healthcare model in South Africa. He asked for and received federal funding for 2 neighborhood health centers, one in Mississippi and the other in Boston, in 1965. Their success spurred the growth of the community health center movement, which is the actual embodiment of providing access to the basic human right of healthcare. Later, the federal government began funding community health centers with the authorization of Section 330 of the Public Service Act. The federal funding of community health centers enabled the dream of our founder, Dr. Stuart Hamilton, to grow from a single pediatric office in the Eau Claire community into an organization that now serves more than 61,000 patients across the Midlands of South Carolina. As we continue celebrating Universal Human Rights Month and Cooperative Health's tremendous contributions in this arena, I wanted to invite our grants administrator, Ms. Cynthia Frazier, to discuss several programs under her purview, which provide access to care to previously underserved and marginalized communities. Welcome, Cynthia, and thank you for joining us today on this segment of the forum.
Good afternoon, Cooperative Health family. It is indeed my pleasure to join you for this episode of the forum.
Your office manages the Migrant Health Program, Parents as Teachers, Choose Well, and the Healthcare for the Homeless program. Please tell us briefly about each of the programs.
Yes, I feel very fortunate to be able to provide oversight to 4 initiatives in my department. The first program that I would like to highlight is the Parents as Teachers program, which is also affectionately known as PAT. A little bit about the Parents as Teachers program. We try to focus on 3 main goals for Parents as Teachers. The first is a family support program. The second is a growth and development program. And the third is an early literacy program. Now, in order to be eligible for the Parents as Teachers program, families must have kids within the age range of 0 to 3 years of age. However, eligibility is limited to those families with kids 0 to 6 months of age. So the next initiative that I would like to highlight is the Choose Well initiative. The Choose Well initiative is funded by the New Morning Foundation, and the whole goal of the Choose Well initiative is to reduce unintended pregnancy among women ages 15 to 44. Now, in order for you to be eligible for a patient, to be eligible for the program, you have to meet one of 5 criteria. You have to be either uninsured, you have to be underinsured, you have to have cost barriers, you have to be a self-pay patient, or you have to be part of our Good Samaritan program. And so in a nutshell, that is our Choose Well initiative. The next program that I have the pleasure of highlighting is the F.O.R.U.M Migrant Health Program, not to be confused with the South Carolina Migrant Health Program. Although both programs are very similar in nature and scope, the 2 programs do share some differences. So again, the program that I'm highlighting today is the F.O.R.U.M Migrant Health Program, which of course is located at our F.O.R.U.M site. And when a patient qualifies for the program, that patient has access to all of the services under the umbrella of the cooperative health. So we're talking primary healthcare services, we're talking podiatry, we're talking any kind of preventative healthcare services, OBGYN, dental, the whole gamut. The final program that I would like to highlight, which is very near and dear to my heart, is our Healthcare for the Homeless program. In order to be eligible for this program, a patient or an individual has to meet the federal definition of homeless. Again, similar to the F.O.R.U.M Migrant Health Program, any patient that is deemed eligible for our Healthcare for the Homeless program has access to all the services that we offer here at the cooperative.
Thank you, Cynthia. So please share with us, what are some of the accomplishments that your team members have made in 2020?
I'm excited to share with you some of the following accomplishments for the 4 programs that we just discussed or highlighted. For the Parents as Teachers program, we were able to expand services to Newberry County. Although the program covers all 4 counties in our service area, our focus primarily has been on serving families in Richland and in Lexington County. But this year, we were able to bring on a new parent educator whose primary focus is Newberry County. And that parent educator is actually housed at Pediatrics of Newberry and will spend some time at Little Mountain Family Practice as well. For my Choose Well initiative, we were able to make huge strides with the Choose Well initiative from the program's inception. When the program first started, pregnancy intention screening was at 16%, which is a very low percentage rate for pregnancy intention screening. I am so happy to report that pregnancy intention screening is now at 82%. So I am very thankful to all the CPMs. I'm thankful to the lead providers. I'm also thankful to all the charge nurses, the entire site leadership team at all 5 implementation sites. You rock. When it comes to the Healthcare for the Homeless program, we're excited to report that we are collaborating with our primary healthcare mobile unit to actually deliver services to unsheltered individuals. Primarily, our focus has been delivering healthcare services to those individuals, to those people experiencing homelessness who reside in transitional housing or shelters. But with the onset of the primary care mobile unit, we are able to extend our outreach, and provide services to those homeless individuals who are actually living on the street. So we're very, very excited about expanding our services to those individuals. And finally, with the Migrant Health Program, very similar to the Healthcare for the Homeless program, we're working in collaboration with the primary healthcare mobile unit to deliver services to the farms in the service area. So that has been a huge accomplishment for that program and for all 4 programs. We're very excited.
Cynthia, before we wrap up this segment, any closing remarks that you would like to share?
I do. I think it's very important for organizations such as Cooperative Health to be here in the community, serving those patients, those individuals who are uninsured, underinsured, who are typically known as disenfranchised. Without the care that we provide here at Cooperative Health and serving as a safety net, those patients wouldn't have access to high quality healthcare services. I know that this has been said time and time again, but I want to leave you on this note. Healthcare is not a privilege. Healthcare is a right, and we need to ensure that all individuals have access to healthcare that is affordable and that's quality care.
Wonderful. Thank you very much, Cynthia, for being a part of our segment today. We appreciate your time.
You are so very welcome. Again, it was indeed my pleasure to highlight these 4 programs. In the future, if you have any questions about any of the programs, please feel free to reach out to myself or any member of my team, or as I refer to them, my dream team. We are here to help, and we are indeed one unit, one family. Thank you so much.
Thank you, everybody, for tuning in to our last installment of the F.O.R.U.M for 2020. In closing, wanted to thank everybody for all of your contributions that you have made in 2020. This truly was an extraordinary year that has affected all of us, either personally or professionally, or both. We do appreciate everyone's commitment to continue providing quality healthcare to our communities who we know are most in need of the services that we provide. As we enter the holiday season, please remember to hold those things close to you that make a difference in your life, things that are very impactful for you. The holidays is a time for gratitude, being more aware of what you have rather than what you don't, recognizing the treasure in the simple things, your health, a child's hug, fertile soil, a golden sunset, relishing in the comfort of the common.